All right, so I'm here to talk to you about rare bleeding disorders, my perspective, which is that as a person with Hermansky-Pudlak syndrome. I'd like to start off with a couple of acknowledgements, first being a land acknowledgement. I wish to pay our respects to the original caretakers of the land on which we're situated, the Wendat, the Haudenosaunee, and the Anishinaabeg First Nations, including the Mississaugas of the Credit. We commit to honoring and celebrating their past, present, future, and recognition. Secondly, I'm speaking specifically to a rare and mild bleeding disorder. So there are other things about my diseases that affect my day-to-day more prominently, although it is a cognizant background part of my daily life, as we'll get into, but just acknowledging my privilege within the bleeding disorder community in that way. And finally, I'm a little bit nervous. It's a bit unusual for me to be so personal. I'm usually presenting in the context of either more academic-based content or speaking other people's writing and dialogue as an actor. And then I'm also a pretty private person when it comes to my medical conditions. I think a lot of people with disabilities may relate to the fact that, of course, I wish to be known for my whole person and for the quality of my work first and foremost, as opposed to, just one small part of who I am. But it is my goal and my desire to walk the talk that I give, which is that I believe discussing and sharing women's health is one of the greatest tools that we have in terms of knowledge translation, in terms of improvement to care, and also how wonderful if someone else with a rare bleeding disorder feels seen or can avoid a pitfall I've made along the way, of which I will share. I'm striving to be as open as possible. Actually, just the other day, I saw Martha Wainwright in concert, and she was so frank and open about her life. That was really inspiring to me. So I'm channeling that energy, and I'll do my best to answer from my own experience or direct you to some resources if I can't answer it. And then finally, I am not in no way a doctor. This is not medical advice. This is simply me sharing my experience. Every body is different, and you should, of course, discuss with your healthcare team what is right for you. A couple disclosures, just quickly, I have some women's health related knowledge translation work that I've been doing recently. So I thought I'd mention that and also plug it. If you're interested in learning more, there's this podcast that I co-host called Women's Health Interrupted through the Women's Health Research Cluster at UBC. If you're interested about gaps in sex and gender-based research, some infrequently discussed sex-specific health challenges, please check that out, which you can find on all major podcast platforms. My other disclosure is that I have no other disclosures yet. However, if the makers of Lice Data want to sponsor me at any time, I'm just saying they can call me. I'm kidding, not really. Anyway, all right. So childhood diagnosis, part 1. So I was diagnosed shortly after birth with oculocutaneous albinism, which is a lack of pigment in hair, skin, and eyes. I came out with a full head of white hair. My parents were told that I would be legally blind. 9 out of 10 people with albinism are, which means that I lucked out big time. I lived an extremely happy childhood with my very proactive parents. They're the best. I had super cute Harry Potter glasses and sunglasses, bucket hats, copper tone for days, which, side note, sunscreens come a long way. So if there are any of my fellow albinos out there, hit me up and I will recommend you some great facial sunscreens. I was also born to move. I had several concussions during my early years. Fortunately, those were pretty mild. There were no broken bones, which is quite shocking. By the age of 12, I was dancing competitively, and my bruises were pretty constant. I was on the school track and field and volleyball teams. These had me covered in even more bruises, which we thought just showed up because I was so pale, which was fair, but no longer plausible by that point because it was so sustained and constant. And I also had noticeable sustained bleeding from small cuts. So my parents took me in for a whole round of tests, which, side note, anyone remember bleeding time? Because they just used to stamp you with vampire bites, basically, and let you bleed until you clot. Thankfully, that is no longer a test anymore. Not my favorite activity. But I was diagnosed with presumed Hermansky-Pudlak syndrome, which is a multi-system genetic disorder that, of course, includes the oculocutaneous albinism, but it also includes a bleeding disorder of platelet dysfunction. And depending on the subtype of the disease, which these were not well known at the time I was diagnosed, you can have all kinds of other complications that include immunodeficiency. So Hermansky-Pudlak syndrome, and I got a double rare bonus when they saw that my organs were on the opposite side during a chest x-ray. So I also have another rare disorder called primary ciliary dyskinesia, which is unrelated. It's a multi-system genetic disorder that affects the little hair-like structures in your body and causes situs inversus. So all of my organs are on the opposite side, bronchiectasis, which is a lung disease, sinus challenges, and as cilia are in your fallopian tubes, it can also potentially affect fertility. For any of the genetics inclined out there, I do have one younger sibling who's unaffected, including his brain and talent. I'm just kidding, he's very talented. But he is also a potential carrier for both diseases. So I was advised by my pediatric hematologist to avoid contact sports. I was followed yearly by pediatric hematology and the best RN ever, besides my mom. My mom is also an RN. But shout out to Erica Crilly. And the only way that my life really changed, honestly, was that my disorder just became my cool fun fact in icebreaker games. I would say I had only ever felt restricted by my disorder in 3 instances in my adolescence. The first being that I was never going to be a classical dancer. I don't have the body type for it. Things are changing now with more athletic looking dancers, but if you had hips in about 10 years ago, like that was not the case. And my gifts as a dancer are in other genres, but point work was cut pretty short when I was bleeding into my blocks, and the bruising on my feet was even more brutal than on other people. So that was a no-go. I was also really good at lacrosse. I'm very competitive. I'm also very scrappy, but avoiding contact sports meant that I did not pursue that beyond the school unit, which given the state of my knuckles, the bruising was for the best. I was also not allowed to participate in the 8th grade art unit of block cutting, which in hindsight, whoever thought it was a good idea to give 13-year-olds X-Acto knives probably should not have been teaching. And it was to my benefit because I got to do an extra unit of musical theater instead, which worked out great for me because my school had an amazing program and it's a field that I work in to this day. All right, so periods. I was so excited to get them. I was a late bloomer. I was 16 years old. And then after that, I was a regular for many years. I did, however, though, have a long time, almost 10 months between my first period and my annual hematology appointment. And I was nearly falling asleep in class. I had just changed into a very intensive training program. So I thought, well, it's just that. It's just the amount I'm training and the level and everything else. Turns out that, of course, after 10 months, my iron was very low. And I was placed on twice daily iron salts supplementation, which at the time was the standard of care. With more research now, that's outdated. And I don't know if this is different now, but in terms of pediatrics, I don't think it's a bad idea to check in with your hematologist right away. That would be what I would advise to save you any of those kind of symptoms that I had. But overall, I didn't know what heavy menstrual bleeding was or that I had it. I knew that I had to change my tampons frequently, but because I was mild in my bleeding disorder, it wasn't overt. Like I wasn't having to change them every hour. I would bleed through my underwear on occasion, but not my pants or my sheets. And there was also a lot of social normalization around this. So I was worried about my dance costumes, but so was everybody else. I would change my tampon before and after a number, but so would everybody else. So my female family members also had heavy periods, which of course we don't know with HPS in terms of the carriership, but often with other bleeding disorders, we know that it runs through women in the family. And they also would use words like hemorrhaging and bemoaning their bleeding, which for their no fault of their own, but for their normalized mine. Eventually I found a Diva cup, which was awesome because it lasted longer between changes for me. And sometimes I would wear a liner pad underneath if it was like very important. I didn't have a leak, but this was a big improvement for me. And that's really how my periods were for a long time. To be continued. So also during this time, along with activities like hiking, travel, canoe camping, skiing, I really never felt like I was restricted by my bleeding disorder. I felt like I was encouraged by my hematology team to make smart choices to avoid contact sports. But if it's a once in a lifetime kind of activity, to go for it. They trusted me to make good decisions. And I trained all throughout my adolescence in competitive pre-professional dance programs. So the A side that you saw of all my activities was one. I also just wanted to give a quick trigger. Sorry, that's already passed. But if you don't like seeing bruises, you're not gonna like that. But I thought I'd quickly show you some recent pictures of what the reality of this looks like on average for me. So I would never complain about these bumps or bruises the same way I would go into rehearsal with a stomach flu and then go off on the side and vomit and come back and go full out. Like that, you just didn't miss. You didn't do that. That's a pretty old school approach, which while it gave me some tenacity when I teach now, it's certainly the antithesis of that. And I always make health a priority whenever I'm in a position of power. I will say, and I'll go into more detail about this later, but a great thing about getting older is seeing the long game and working smarter and not harder. So now I'm much more cognizant of wearing knee pads, about asking for what I need in a room and not feeling afraid to do that, not doing everything full out all the time, being very diligent about warm-ups and cool downs, about icing and so on. So early adulthood transition, it was a bit bumpy by my own volition. So I was more concerned, to be totally frank, with academic achievement and career advancement than I was in being an advocate for my health. I was very, very serious as a young person. And I just like really wasn't that interested in skipping classes to spend 5 hours going to a hematology appointment. And so I also didn't give my clinicians much to go on other than my periods are fine, I'm fine. You know, I didn't want to draw attention for anything other than positives. And then of course, being in a hematology oncology clinic, you're always seeing people really suffering around you. And I was like, I'm so lucky, I'm fine. And so I dismissed any of the symptoms or things that I was having going on. And I was also, though, remember, under the normalized impression that my periods were fine. So I didn't need to do anything beyond, you know, just continuing my iron supplementation, but it wasn't totally normal. I had chalked up some very serious like cyclical fatigue during my undergrad to stress and depression from school and work, as opposed to, in hindsight, seeing in all of my records that my iron levels were typically deficient throughout that period. I also was dismissed by a clinician. When I had mentioned an increase in my fatigue, I was told, welcome to adulthood, everybody's tired. So not an overall positive transition period for me. I did, though, have 2 successful surgeries in this period. The first was wisdom teeth, which I had tranexamic acid and DDAVP for. I still had some bleeding. After this, it was about a 2-week-long recovery. Not the best time, but didn't have to go in for any additional help in terms of my bleeding. And then I also had an eye surgery, and I had a platelet transfusion for this. And I still had intraoperative bleeding. It was very painful. They wake you up in the middle to complete the surgery, like Clockwork Orange style. And I spent several days without seeing. And then after about a month-long recovery, it took about that long for the blood in my eyes to fully disappear. But overall, a success. And the only other thing during this time was I had an ankle injury, which was just chronic swelling and instability. I had textbook sinus tarsi, so I had a shot of cortisone, and it's been fine ever since. PT exercises, maintain strength, I supplement vitamin D as instructed, and so on. So at the end of 2018, gosh, COVID time, what is it? I moved to Toronto and I was transferred to that clinic. In regards to my symptom management, I continued my iron supplementation. I was also placed on tranexamic acid, which it took me a while to try it. I thought I didn't need it. I never want to take medication that I don't need. I always have side effects. And I had a terrible experience with the hormonal contraceptive pill that was offered to me before. I'm just generally very sensitive. So I do have slight side effects with the TXA, but for me, they're mild and they're absolutely worth it for the benefits, which meant, again, this might not be right for everybody. This is just how it works for my body, but it definitely shortened the length and the heaviness of my periods. And it also regularized my period cycle. I think my body was like, finally, a normal amount of blood. Here's a normal cycle. So that was a really great bonus. We love it. Also during this time, I'm very grateful to have had a physician who advocated for me. She sent me for extensive follow-up and investigations of all of my systems that were related to either of my diseases. And here I also had genetic confirmation and diagnosis of my type of HPS. Hence, diagnosis part 3. There are many phases of this, but it was important because there's future ramifications related to bleeding. So type 1, the type I have, will develop early onset pulmonary fibrosis, most likely, and that has potential ramifications for me for platelet transfusions in the instance that I require a lung transplant down the line, because alloimmunization is something that can occur when you have platelet transfusions. So I want to limit the number that I receive, which is obviously good to know. I don't know that I will have children, but in the instance that I do, important information to have. Other subtypes, of course, that I should mention is that some folks can have immunodeficiency issues, and some people will also have major bowel issues similar to Crohn's disease, which of course is also further complicated by a bleeding disorder, as if you're having internal bleeding or bleeding through your stool and you can't see it because you're legally blind, you can imagine, this causes all kinds of complications. Okay, let's talk about push mentality. It's something that as a dancer and in many high performance sports, it's inundated from an early age. You're literally training your body to be comfortable in pain. Like I said, I'm much more diligent now about taking precautions, not doing everything at 150% all the time, being diligent about warming up, cooling down, icing, ricing, and all of that. However, an example of this mentality over the pandemic, I was briefly back in BC. I had an unconfirmed kind of maybe joint bleed. I'm not sure because I didn't know what was going on and I mismanaged it. Learning experience. I was across provinces. I didn't want to be a pain in the butt. See this old mentality creeping back in. I thought it wasn't a big deal, but I was surfing in Tofino, which was our local health unit, by the way. I'm not a person who travels during a global pandemic, just so you know that. But what I thought was that it was an overuse injury. And so I just twisted it badly on a wave, adrenaline. I didn't really feel it. I just kind of clocked it and moved on. And over several weeks, I just peeled off layers of activity. And then after a week of it hurting when running, I spent the next week just cycling. And then by the third week, I was having difficulty walking and it swelled after every session. I riced it. It wasn't improving. So I called my old sports doctor and GP and they were like, go, we're going to have a better look at it. By the time I ended up having an MRI, it was no longer visible. So I did a lot of PT and I was working on it and it's back to normal now. Here's what I should have done. Called my hematology clinic and discussed it right away. I also shouldn't have dismissed my symptoms, especially if it's a new sensation. So now I know what to look for and what it feels like. I can take action a lot sooner and get it treated appropriately. So learning, but don't dismiss or minimize your symptoms. My lesson for anyone in a similar situation is obviously you have to trust your body. You're very in tune with it, but also know that your limits may not always be the healthiest and have tools in place to track that. So for instance, now I carry snap packs on hand. After a particularly intense audition, I can ice my knees or any bruises immediately after, or if I bump my head accidentally, I can get ice on it immediately. I'm also not afraid anymore to inconvenience people. They're generally happy to help if they can. And then because I know that I often push beyond what is the norm, I discuss my symptoms with somebody I trust. So my mom's a registered nurse, but you can talk to your clinic nurse, GP, appropriate person, just double check, just, to have that to check sometimes when I need to see a member of my team. And this can also apply to all areas of your health. So now even, for example, I have a thermometer, a pulse oximeter, these things I would have turned my nose up or thought were stupid before. I have them on hand to check because I know about myself. I'll shrug off a fever, shrug off pain, a lung infection even. So I think it's important to A, know what is acceptable and know what is normal and what that actually is, not your normal, right? And B, have tools on hand that can help you know when to ask for help. All right, it's not all, I know we saw some bruises and all of that, but it's not all bad. These are some of the positive impacts my bleeding disorders had on my life. It's gotten me involved in other projects like Diva Day International, spreading bleeding disorder awareness among folks rurally in Canada and across Kenya. Also through the BC Rural Surgical Obstetrical Network and the Women's Health Research Cluster, I've gotten involved in knowledge translation work and a whole area of interest in my life that probably potentially never would have been. Also overall, I think having any health challenge certainly, hopefully, expands your empathy. And I think it makes me unafraid of my body and more in tune with it. But I also think that especially with a disorder that has sex-specific challenges and has been historically marginalized, it's made me a lot more vocal on women's health issues overall and to try to work and continue fighting to destigmatize talking about vaginal blood loss for the sake of bleeding disorders, but also so many other health conditions and socio-cultural considerations that are wrapped up in that. I think you'd be surprised. I was surprised, even within a very progressive community, like the arts bubble is definitely a real thing on so many issues. And we talk about our bodily functions ad nauseum, but I was shocked at really how rarely periods were talked about. And after bringing them up in conversations, so many people are like, wow, yeah, I've never talked about that or thought about that in that way before. So let's continue in whatever little corner you have just to keep talking about it and to keep destigmatizing these issues. It's so important. And now we continue to have these fantastic resources. So I've attached those at the end, links to websites like Fix Hemophilia Ontario, the Canadian Hemophilia Society. There's also, of course, the World Federation for Hemophilia left off there, the Let's Talk Period website. So many wonderful things that have been developed, and let's keep going. Thank you so much for your time. You can find me on Instagram. My website's on there with my email and all that. So please do reach out. But I want to thank everybody for their time and attention. So thanks very much.